Poetry is the first that people notice about us when we meet them. Throughout their lives, especially as they get older, hair care may become more important for women. Some researchers have found that starting in the late 20th century, perceptions about aging began to change. It is becoming increasingly important for older women to have beautiful, attractive hair to avoid negative perceptions of aging. Some women start experiencing hair loss as they get older, especially during menopause. Hair loss in women over the age of 50 is a common problem. It can be upsetting and negatively affect the psyche, but there are many treatments to reduce hair loss in women. The medical term for baldness is alopecia areata. Complete baldness of the scalp is alopecia areata. Keep reading to learn more about the causes of hair loss in women and the treatments available to reduce hair loss. You will learn that some types of hair loss in women are temporary, while others may be permanent and require treatment. How does hair loss occur in women? We only think of hair loss as a common problem in men, but women also suffer from it. What causes hair loss in women? Hair loss in women is a common problem, and it increases with age. This type of hair loss may start in your 40s, 50s, or 60s. Also, hair loss may be hereditary, and genes inherited from the mother or father, or both, may contribute to the condition. Women who suffer from hair loss often experience psychological distress as a result. Since female hair loss tends to be a chronic and progressive condition, early diagnosis and treatment are crucial. This may help stop hair loss. Some treatments may help stimulate new hair growth, which is why you should see a dermatologist if you're experiencing hair loss. Hair loss in women can be stopped depending on the cause and when the problem is identified. Early treatment may slow or reverse hair loss in women. Now let's see what causes hair loss. There are many different types of hair loss with a variety of possible underlying causes. Many medical conditions are associated with hair loss in women. Common causes include thyroid problems and hormone imbalances. Wondering how to stop hair loss in women? When the underlying cause of hair loss is diagnosed and treated, hair loss may stop, and hair may grow back. Stress, dietary factors, and genetics may also play a role in hair loss. Extreme physical stress such as going through labor surgery, or serious illness can cause a type of hair loss called telogen flux. This is a condition in which stress forces large numbers of follicles into a resting phase, and after a few months, hair falls out. Sometimes doctors cannot determine the cause of hair loss. Other possible causes of hair loss include radiation therapy, cancer, kidney failure, liver failure, drug side effects, and autoimmune diseases. Causes hair loss. PCOS could be the cause of hair loss. Alopecia areata, ringworm, childbirth may be one of the causes of hair loss. Pay attention to birth control pills, they may cause hair loss. Cancer treatment is a common cause of hair loss, physical and emotional stress. Is there medicine for hair loss? Minoxidil or Rogaine is a topical medication used to treat female pattern hair loss and male pattern baldness. It was initially developed as a blood pressure medication and was used off-label to treat hair loss until it became approved for this purpose. Minoxidil can slow the progression of hair loss. Most of the women who use the drug experienced hair regrowth. The medication must be used continuously to maintain results. Other types of treatment work for different types of hair loss. Corticosteroids help suppress the immune response that damages hair follicles in people with alopecia areata. Once the follicles recover, the hair can grow back. If nutritional deficiency underlies hair loss, eating a healthy diet with adequate protein and nutrients can help hair regrowth. Some medical problems may lead to hair loss. Treating these conditions appropriately may help restore hair growth. Does laser work effectively in case of hair loss? Low-level laser therapy is a treatment that may help regrow hair and reverse hair loss in women. Lasers are available for home and physician use. Laser therapy should be used for 2 to 4 months before results are visible. Laser therapy is an alternative to surgery and hair transplantation. Laser therapy may be effective for 50% of men over the age of 40 and 75% of women over the age of 65 who experience certain types of hair loss. What about hair transplant surgery? Hair transplantation is a surgical procedure in which a doctor removes hair from one part of the scalp and transfers it to other areas of the scalp. In cases of female hair loss, hair may be thin all over, so it can be difficult to find suitable donor sites for hair harvesting. Hair transplantation is most effective for those who suffer from male pattern baldness or who suffer from thinning front scalp. Patients may require multiple sessions to achieve the desired results. Hairdressers are also a big cause of hair loss in women. A new haircut or hairstyle may be what you need to make your hair look fuller. Ask your hairdresser for advice on getting a shorter haircut, sectioning your hair in a different spot, or adding curls or waves to add volume to your hair. Women's hair loss products include the use of styling products designed for thinning hair. Some products are added to the roots while the hair is damp before it dries. Some beauty products can help mask the appearance of bald spots. Keratin fiber cosmetics have a constant charge that makes hair look fuller.